There's both good news and bad news in the fight against the opioid epidemic. Drug overdose deaths are down, but those on the front line say there is still a lot of work to be done. Local 12's Anjanette Levy shares the Heroin Coalition's latest update. Anjanette?
Well, Rob, everyone who was present for this update says this is a journey and we haven't reached the final destination yet. There are a bunch of pieces to this, from law enforcement reducing the supply to prevention programs and expanding treatment.
We have a trend line in the community that is moving in the right direction.
County Commissioner Denise Driehaus says overdose deaths are down for 2018. The numbers aren't yet final, but right now the coroner says 440 people died last year from overdoses versus 570 in 2017. That's a decrease of more than 20%.
It's difficult, though, to be overly optimistic because at any moment in time, that's subject to change. We could have a bad batch on the street tomorrow and get a spike.
Heroin Coalition members say there's more naloxone available, which reverses an overdose. And last year, Hamilton County Health Commissioner Tim Ingram says more than 353,000 needles were exchanged for clean ones, potentially limiting the spread of diseases such as HIV. The needle exchange employees also talked to addicts about getting help.
I would say to you, we're making lots of good progress. This is a collective effort from everyone that you've heard here.
The data does show that treatment works, so we want to get people into those different levels of care as soon as they can.
Last year, quick response teams expanded countywide to get people who've overdosed into treatment. The number of criminal investigations initiated from overdose deaths is down nearly 10%, and the amount of heroin seized is down 55%. But drugs seized that were mixed with fentanyl skyrocketed 320% last year. And this year, the work continues.
Some still look at this as not as a disease, but as a moral failing. And a lot of people are still in denial.
Now, reducing the stigma surrounding addiction is part of that work that will continue. Commissioner Driehaus says that all of this costs money and more money is needed for funding programs, and they've reached out to Governor DeWine's administration to discuss that. The county and the city are also working on a new pre-arrest diversion program where a person who has committed a crime because of addiction will be sent to treatment instead of jail. Rob?